It's Monday, which means I am in our cleft, lip, and palate clinic today, and I figured I'd chat about the most common things we see with regard to concerns in cleft, lip, and palate. So again, most of our kids adapt and adjust very well, and they have the exact same concerns that any other child their age would have. However, some of the most common things we address is how to talk about cleft, lip, and palate with the child themselves when they're younger, with their siblings, and with their peers. Another common thing we deal with is preparing for surgery. So when to tell the child they're about to have surgery, how to prepare for that, and then proactive pain management. Something else we sometimes deal with is bullying and what to do in that case. Unfortunately, it is quite prevalent across just schools in general, but we'll chat about that. And then another really common concern we get is excessive picky eating, especially for kiddos who have the cleft palate. And so sometimes they meet criteria for RFID, sometimes they don't, but that selective eating is something we can address. And then of course, just like with any other kid and teen, we talk about sleep, electronics use, school, assess for any developmental concerns, things like that. Let me know if you have any other questions about cleft, lip, and palate.